Question 1. A nurse in the emergency department is evaluating a pregnant client at 37 weeks gestation who presents with intense abdominal pain and significant vaginal bleeding. Which nursing action should be avoided at this time? A. Conducting a vaginal examination. B. External monitoring of the fetal heart rate. C. Palpation of the abdomen. D. Measurement of blood pressure and other vital signs. Correct. Answer A. Option A is correct because performing a vaginal examination in a client with active vaginal bleeding, especially in the late stages of pregnancy, is generally not advised unless in a fully equipped labor and delivery unit. Vaginal examinations in such scenarios could potentially worsen the condition or cause further complications. Option B is incorrect because external fetal heart rate monitoring is crucial for assessing fetal status and ensuring timely interventions if necessary. Option C is incorrect because palpating the abdomen can provide important information regarding uterine contractions and tenderness, which could help in diagnosing the underlying cause of the bleeding. Option D is incorrect because monitoring the client's vital signs is essential to evaluate the mother's physiological status and guide immediate care decisions. Question 2. A nurse is advising a client with advanced kidney disease on appropriate dietary choices. Which of the following foods should the nurse suggest as suitable for this client? A processed vegetable burger. B. Applesauce. C. Raw tomatoes. D. Honeydew melon. Correct. Answer B. Option B is correct because applesauce is recommended for individuals with end-stage renal disease as it is low in potassium, making it a safe option for managing electrolyte levels. Option A is incorrect because processed vegetable burgers often contain high levels of sodium and potassium, both of which should be limited in patients with end-stage renal disease. Option C is incorrect because raw tomatoes are high in potassium, making them unsuitable for a renal diet. Option D is incorrect because honeydew melon is high in potassium, which could pose a risk of hyperkalemia, a common and dangerous complication in clients with renal failure. Question 3. A pregnant client at 31 weeks presents at the clinic with complaints of facial swelling, swelling in her hands, and a severe headache. What should be the nurse's initial action? A. Insert a urinary catheter. B. Take the client's blood pressure and other vital signs. C. Measure the fundal height. D. Conduct Leopold maneuvers. Correct answer B. Option B is correct because the symptoms of facial swelling, hand swelling, and a severe headache are indicative of potential preeclampsia, a serious pregnancy complication characterized by high blood pressure and signs of damage to other organ systems, often the liver and kidneys. The nurse's priority should be to assess the client's blood pressure and vital signs to determine the severity of the condition and decide on the next steps for intervention. Option A is incorrect because inserting a urinary catheter is not a standard immediate response to symptoms of preeclampsia. This action is more relevant in managing fluid output if preeclampsia is confirmed, but not as an initial response. Option C is incorrect because while fundal height measurement is important for tracking fetal growth, it does not address the urgent concern of potential preeclampsia. Option D is incorrect because Leopold maneuvers are typically used to assess fetal position, which is not directly relevant to the immediate concern of possible preeclampsia. Question 4. The nurse is developing a care plan for a client recovering from hip surgery who needs to regain the strength required to climb stairs to reach their bedroom. Which referral should the nurse prioritize? A dietary consultation. B. Occupational therapy. C. Physical therapy. D. Case management. Correct answer C. Option C is correct because physical therapy should be prioritized for a client recovering from hip surgery, particularly when the goal is to regain strength for specific functional activities like climbing stairs. Physical therapists are experts in rehabilitation, focused on improving mobility, strength, and overall physical function. Option A is incorrect because while nutrition is important, dietary consultation does not directly address the client's immediate need to regain strength and mobility post-surgery. Option B is incorrect because occupational therapy focuses on assisting clients in performing activities of daily living, which may indirectly help with stair climbing, but is not as targeted as physical therapy in strengthening the necessary muscles for this task. Option D is incorrect because a case manager coordinates care and resources, but does not directly contribute to the physical rehabilitation needed for stair climbing. Question 5. A nurse is monitoring several clients who are currently taking lithium. Which client would be at the greatest risk of developing lithium toxicity? A client with chronic headaches starting naproxen. B. A client with high blood pressure recently prescribed clonidine. C. A client with asthma using inhalers. D. A client with hypothyroidism taking levothyroxine. Correct answer, A. Option A is correct because non-steroidal anti-inflammatory drugs, like naproxen, can significantly increase the risk of lithium toxicity. Non-steroidal anti-inflammatory drugs reduce renal blood flow, leading to decreased clearance of lithium, which can cause an elevation in serum lithium levels to toxic levels. Options B, C, and D are incorrect because they do not involve medications that are known to significantly increase lithium levels or pose a substantial risk of toxicity. Bronchodilators, clonidine, and levothyroxine do not have significant interactions with lithium that would increase the risk of toxicity. Question 6. A child at a school clinic is angry and accuses their teacher of failing them on a test, despite admitting that they did not study. What psychological defense mechanism is the child displaying? A. Compensation. B. Undoing. C. Projection. D. Rationalization. Correct answer. C. Option. C is correct because the child is exhibiting projection, a defense mechanism where individuals attribute their own unacceptable thoughts, feelings, or shortcomings to others. In this case, the child is blaming the teacher for their failure on the test, even though the failure was due to their lack of preparation. Option A is incorrect because compensation involves covering up a weakness by emphasizing a strength, which does not align with the child's behavior in this scenario. Option B is incorrect because undoing involves attempting to negate or make up for a previous action or feeling, which is not the case here. Option D is incorrect because rationalization involves creating a logical but false explanation to justify an action or decision, which is different from projection. Question 7. A nursing student is studying the dynamics of abusive relationships and questions why victims of domestic violence often remain with their abusers. Which model provides an explanation for the recurring and escalating nature of domestic abuse? A. The cycle of dysfunctional relationships. B. The cycle of harm. C. The Duluth model. D. The cycle of abuse. Correct answer. D. Option D is correct because the cycle of abuse, first described by Lenore Walker in 1979, offers insight into why individuals in abusive relationships may find it difficult to leave. This model outlines 3 phases: the tension building phase, the acute battering incident, and the honeymoon phase. During the tension building phase, tension gradually increases, leading to an abusive incident. After the abuse, the honeymoon phase follows, where the abuser may express remorse and promise change, leading the victim to stay in the relationship. This cycle repeats and often escalates in severity over time, trapping the victim in the cycle of abuse. Options A and B are incorrect because they do not accurately describe recognized models of domestic abuse. Option C is incorrect because the Duluth model focuses on the power and control dynamics in abusive relationships rather than the cyclical nature described in the cycle of abuse. Question 8. A parent is learning about immunization schedules for their infant. Which vaccine should the nurse inform the parent is typically administered before the child reaches 8 months of age? A varicella, B. Haemophilus influenzae, type B Hib, C. Tetanus, diphtheria, and pertussis tdap, D. Human papillomavirus HPV. Correct answer, B. Option B is correct because the Haemophilus influenzae type B Hib vaccine is routinely given to infants starting at 2 months of age, with the series completed by 12 to 15 months. This vaccine is essential for protecting against serious bacterial infections like meningitis and pneumonia. Administering it before 8 months ensures the child develops immunity during a vulnerable period. Option A is incorrect because the varicella vaccine is typically given at 12 to 15 months, with a second dose at 4 to 6 years. Option C is incorrect because the tetanus, diphtheria, and pertussis vaccine is given as a booster dose at ages 11 to 12 years. Option D is incorrect because the human papillomavirus vaccine is administered starting at age 9 and is typically recommended for preteens. Question 9. A nurse is assessing a newborn who has yet to pass their first stool within the first 24 hours of life. What is the name of the initial stool typically passed by newborns? A hematochezia, B. Diarrhea, C. Meconium, D. Melena. Correct answer, C. Option C is correct because meconium is the first stool passed by a newborn, typically within the first 24 hours after birth. This dark green sticky substance is composed of materials ingested during the time the infant spent in the uterus, including amniotic fluid, mucus, and cells. The passage of meconium is an important indicator of the infant's gastrointestinal health. Failure to pass meconium within the first 24 to 48 hours could suggest underlying conditions such as intestinal obstruction or congenital disorders like cystic fibrosis or Hirschsprung's disease. Option A is incorrect because hematochezia refers to the passage of fresh blood through the anus, typically indicating lower gastrointestinal bleeding. Option B is incorrect because diarrhea refers to loose or watery stools, which is not applicable to the first stool of a newborn. Option D is incorrect because melena refers to dark, tarry stools that result from bleeding in the upper gastrointestinal tract. Question 10. During a routine assessment, a nurse observes that a client who has been categorized as having no special skincare needs has developed reddened areas over several bony prominences. What should the nurse do next? A conduct and record, a focused assessment of the client's skin condition. B. Apply an antibiotic ointment to the affected areas. C. Note the findings and proceed with routine care. D. Initiate an emergency skin assessment. Correct answer, A. Option A is correct because the nurse should immediately perform and document a focused assessment of the client's skin integrity, particularly given the appearance of reddened areas over bony prominences, which could indicate the early stages of pressure injuries. Early intervention is crucial in preventing the progression of these injuries to more severe stages, such as ulcers, which can lead to significant complications. The focused assessment will provide detailed information on the extent of skin breakdown and guide the appropriate nursing interventions to prevent further deterioration. Option B is incorrect because applying an antibiotic ointment may not be appropriate without first determining the cause of the redness. It could lead to further skin irritation or mask underlying issues. Option C is incorrect because merely documenting the finding without further assessment or action may allow a preventable condition to worsen. Option D is incorrect because an emergency assessment is reserved for life-threatening situations, whereas a focused skin assessment is the appropriate response to the observed findings. A patient newly diagnosed with bipolar disorder is being assessed for appropriate medication management. Which drug should the nurse anticipate will be prescribed to manage this condition? A. Risperidone. B. Alprazolam. C. Sertraline. D. Lamotrigine. Correct answer. D. Lamotrigine is a key medication used as a mood stabilizer in the treatment of bipolar disorder, particularly effective in preventing the occurrence of both manic and depressive episodes. Risperidone, a second-generation antipsychotic, is sometimes used for managing bipolar disorder, but is not typically the first choice for long-term mood stabilization. Alprazolam is primarily used as an anxiolytic and does not possess mood-stabilizing properties. Sertraline is a selective serotonin reuptake inhibitor antidepressant and is not typically prescribed alone in bipolar disorder due to the risk of inducing mania. A nurse is monitoring a client with diabetic ketoacidosis who is receiving an infusion of regular insulin. Which laboratory value should be reported to the healthcare provider immediately? A blood urea nitrogen of 24 milligrams per deciliter. B potassium level of 3.2 milliequivalents per liter. C hemoglobin A1C of 8.9%. D blood glucose of 297 milligrams per deciliter. Correct answer. B. Potassium is a critical electrolyte that must be closely monitored in patients being treated for diabetic ketoacidosis, particularly during insulin therapy. An elevated blood glucose level is expected in a patient with diabetic ketoacidosis and will decrease gradually with insulin therapy. An elevated blood urea nitrogen level indicates dehydration, a common finding in diabetic ketoacidosis. An elevated hemoglobin A1C level reflects poor long-term glycemic control, but is not an acute finding that necessitates immediate action. During the assessment of a pregnant client in active labor, the nurse notices that the fetal heart rate temporarily rises above the baseline and then returns to normal after about 15 seconds. What should be the nurse's immediate action? A. Notify the physician. B. Document the finding and continue monitoring. C. Reposition the client onto her left side. D. Administer oxygen via face mask. Correct answer. B. A transient increase in the fetal heart rate, known as an acceleration, is a positive indicator of fetal well-being. Notifying the physician is not necessary for a normal and reassuring finding, like a fetal heart rate acceleration. Repositioning the mother is not required when accelerations are present. Administering oxygen is not indicated for fetal heart rate accelerations. During a physical examination, the nurse percusses various areas of a client's abdomen. Which organ is expected to produce a tympanic sound upon percussion? A liver. B. Lung tissue. C. Stomach. D. Tympany is an abnormal finding. Correct answer. C. Tympany is a high-pitched, drum-like sound that is typically heard over air-filled structures such as the stomach and intestines. The liver, being a solid organ, produces a dull sound upon percussion. Percussion of healthy lung tissue typically produces a resonant sound. Tympany is a normal finding over air-filled structures like the stomach and intestines. A client presents to the emergency department with altered mental status, slurred speech, pinpoint pupils, and decreased respiratory rate. Which condition is the nurse most concerned about? A. Alcohol intoxication. B. Cocaine intoxication. C. Opioid intoxication. D. Alcohol withdrawal. Correct answer. C. The clinical presentation of pinpoint pupils, slow breathing, slurred speech, and altered mental status strongly suggests opioid intoxication. Alcohol intoxication can cause slurred speech and impaired coordination, but it does not typically cause pinpoint pupils. Cocaine intoxication usually results in dilated pupils, increased heart rate, hypertension, and hyperactivity. Alcohol withdrawal presents with symptoms such as tremors, agitation, anxiety, and seizures. A nurse is preparing the care plan for an adolescent who is scheduled for spinal fusion surgery and will be hospitalized for several days. What is the best action the nurse can take to address the client's psychosocial needs? A. Encourage the parents to stay overnight. B. Arrange visits from the client's friends. C. Suggest a patient-controlled analgesia device. D. Provide meals high in protein and vitamin C. Correct. Answer. B. Adolescence is a developmental stage where peer relationships become increasingly important. While parental presence is comforting, adolescents are more likely to derive emotional support from their peers. Patient-controlled analgesia is helpful for managing post-operative pain, but it addresses physical rather than psychosocial needs. A diet high in protein and vitamin C is beneficial for physical recovery and wound healing, but does not directly address psychosocial needs. After administering a bolus of intravenous fluids to an infant, the nurse weighs the infant's wet diaper and notes it weighs 40 grams. How many milliliters of urine should the nurse document? Correct. Answer. 40 milliliters. In neonatal and pediatric care, accurate measurement of urine output is crucial for monitoring hydration status and renal function. The weight of the wet diaper in grams directly corresponds to the volume of urine in milliliters, as 1 gram of weight equals 1 milliliter of urine. Therefore, a diaper weighing 40 grams indicates that the infant has produced 40 milliliters of urine. This method allows healthcare providers to precisely track fluid output, which is particularly important in the care of infants who cannot communicate their needs. A nurse is preparing to insert an indwelling urinary catheter and is considering which tasks to delegate to unlicensed assistive personnel. Which task can be safely delegated? A. Prepare the sterile field. B. Assess the bladder for distension. C. Explain the procedure to the patient. D. Place the catheter kit near the bedside. Correct. Answer. D. Placing the catheter kit at the bedside is a task that can be delegated to unlicensed assistive personnel, as it involves setting up the environment and ensuring that all necessary equipment is available. Setting up the sterile field requires knowledge of sterile technique to prevent contamination, which is beyond the scope of practice for unlicensed assistive personnel. Assessing bladder distension involves clinical judgment and is an evaluative task that should be performed by a licensed nurse. Explaining the procedure to the patient is an educational task that requires understanding of the procedure. A patient with type 1 diabetes presents to the emergency department with signs of diabetic ketoacidosis. Which of the following assessment findings requires the nurse's immediate attention? A respiratory rate of 22 breaths per minute. B. Heart rate of 128 beats per minute. C. Blood glucose of 280 milligrams per deciliter. D. Nausea and vomiting. Correct answer. B. A heart rate of 128 beats per minute indicates tachycardia, which can be an early sign of hypovolemic shock in a patient with diabetic ketoacidosis. A respiratory rate of 22 breaths per minute is within the normal range and reflects the body's attempt to compensate for metabolic acidosis. While a blood glucose level of 280 milligrams per deciliter is elevated, it is expected in diabetic ketoacidosis and will be managed as part of the standard treatment protocol. Nausea and vomiting are common symptoms in diabetic ketoacidosis, but are not as immediately life-threatening as signs of shock. During a follow-up visit, a client on fluoxetine makes the following statement. Which statement should cause the nurse the most concern? I can't sleep through the night. B. I have diarrhea every day. C. I just don't see any point in living. D. I'm using eye drops for dry eyes. Correct answer C. The statement, I just don't see any point in living, is highly concerning as it suggests the client may be experiencing suicidal ideation. Difficulty sleeping is a common side effect of fluoxetine, but does not indicate an immediate threat to the client's safety. Diarrhea is another common side effect of fluoxetine, but does not pose an urgent concern. The use of artificial tears to manage dry eyes is a typical response to one of fluoxetine's side effects. A nurse is assessing a victim involved in a hazardous chemical incident at a local factory. The client is alert but unable to walk and presents with a respiratory rate of 28 breaths per minute and a capillary refill time of less than 2 seconds. What priority level should the nurse assign to this client? A. Immediate, red tag. B. Delayed, yellow tag. C. Minimal, green tag. D. Expectant, black tag. Correct answer B. The client should be assigned a delayed priority indicated by a yellow tag due to their responsiveness, respiratory rate, and capillary refill time. These signs suggest the client is stable but not ambulatory, which warrants prompt but not immediate care. Clients tagged with yellow have injuries that are significant but not immediately life-threatening and can wait for medical attention for up to an hour without a high risk of their condition worsening. A red tag is reserved for those requiring immediate life-saving interventions due to critical conditions such as severe hemorrhage or compromised airways, which this client does not present. A green tag is used for clients who have minor injuries and are ambulatory, which does not apply here. A black tag is for those who are either deceased or have injuries so severe that they are unlikely to survive even with treatment, which is not the case for this client. A newborn, born 10 hours ago, is observed by the nurse to be extremely irritable, exhibiting a high-pitched cry and experiencing tremors. Which condition should the nurse suspect in the newborn? A neonatal sepsis. B. Hypoglycemia. C. Neonatal abstinence syndrome. D. Hypothermia. Correct answer C. The newborn's symptoms of extreme irritability, a high-pitched cry, and tremors strongly suggest neonatal abstinence syndrome, which occurs when a newborn withdraws from substances the mother used during pregnancy. This syndrome is most commonly seen in infants exposed to opioids in utero. The constellation of symptoms, including jitteriness and a shrill cry within the first 24 hours of life, is indicative of drug dependence, requiring specialized care and monitoring. Neonatal sepsis typically presents with lethargy, poor feeding, and unstable body temperature, rather than the symptoms described. While hypoglycemia can cause jitteriness, it is usually accompanied by lethargy and poor feeding, not hyperactivity, and a shrill cry. Hypothermia in a newborn would manifest as cool extremities, slow heart rate, and respiratory depression, which are not seen in this case. A healthcare provider prescribes an infusion of 150 milliliters of normal saline to be administered over a period of 60 minutes. What should be the infusion rate in milliliters per hour? A 100 milliliters per hour. B. 150 milliliters per hour. C. 200 milliliters per hour. D. 250 milliliters per hour. Correct answer B. The calculation of the infusion rate is as follows. Convert the total infusion time from minutes to hours. 60 minutes divided by 60 minutes per hour equals 1 hour. Determine the infusion rate by dividing the total volume by the time. 150 milliliters divided by 1 hour equals 150 milliliters per hour. This indicates that the infusion pump should be set to deliver 150 milliliters of saline per hour, ensuring the entire volume is infused within the prescribed 60 minutes. A nurse is reviewing the medications prescribed to several clients. Which of the following medication prescriptions should the nurse critically evaluate? A levothyroxine for a client in a myxedema coma. B. Hydrochlorothiazide for a client with hyperparathyroidism. C. Hydrocortisone for a client with adrenal insufficiency. D. Regular insulin for a client with diabetic ketoacidosis. Correct answer, B. The prescription of hydrochlorothiazide for a client with hyperparathyroidism warrants critical evaluation. Hydrochlorothiazide is known to increase calcium retention by the kidneys, which would exacerbate hypercalcemia in clients with hyperparathyroidism. This could lead to serious complications, such as nephrocalcinosis or bone demineralization. Proper management of hyperparathyroidism often involves hydration with saline and using a loop diuretic like furosemide, which promotes calcium excretion rather than a thiazide diuretic. Levothyroxine is essential in treating myxedema coma, a life-threatening condition due to severe hypothyroidism, by restoring normal thyroid hormone levels. Hydrocortisone is vital in treating adrenal insufficiency, as it replaces deficient cortisol levels, preventing adrenal crisis. Regular insulin is the treatment of choice for diabetic ketoacidosis, as it lowers blood glucose levels and corrects metabolic acidosis. During a staff education session on total parenteral nutrition, the nurse discusses various conditions that may warrant its use. Which condition justifies the use of total parenteral nutrition? A. Acute appendicitis. B. Gastroesophageal reflux disease. C. Diverticulosis. D. Severe pancreatitis. Correct answer, D. Total parenteral nutrition is indicated for clients with severe pancreatitis because oral or enteral nutrition can exacerbate the inflammation and pain associated with the condition. Pancreatitis often results in the inability to tolerate food due to severe abdominal pain, nausea, and vomiting. Total parenteral nutrition provides the necessary nutrients intravenously, bypassing the gastrointestinal tract, which helps in managing the symptoms and promoting recovery without stimulating the pancreas. Appendicitis generally requires surgical removal, and the client can usually resume oral intake shortly after surgery. Gastroesophageal reflux disease is managed through dietary modifications and medications, and clients typically do not need total parenteral nutrition. Diverticulosis is treated with a high-fiber diet and does not require total parenteral nutrition unless complications such as perforation or fistula formation occur. The nurse aims to understand the diverse cultural beliefs of a patient during assessment. What is the primary reason for this understanding? A. Facilitate communication with the patient's family. B. Ensure culturally appropriate dietary orders. C. Coordinate a spiritual consult. D. Prevent assumptions about the patient's needs. Correct answer. D. Understanding the cultural beliefs of a patient primarily aims to prevent making assumptions about their needs based on cultural stereotypes. Every patient is unique, and their personal beliefs and practices may not align with general cultural norms. By recognizing these individual differences, the nurse can deliver personalized care that respects the patient's cultural background, ensuring that care decisions are not based on incorrect assumptions. Although communicating with the family is important, it is secondary to avoiding assumptions about the patient's care needs. Dietary preferences should be based on the patient's specific cultural and personal preferences, which requires understanding but is not the primary goal. A spiritual consult should be offered based on the patient's expressed desires, not assumptions about their cultural practices. After cervical spine surgery, the nurse is monitoring the patient's recovery. Which of the following symptoms should the nurse prioritize for immediate evaluation? A. Ability to move both arms. B. Minimal drainage on the surgical dressing. C. Difficulty swallowing fluids. D. Discomfort at the surgery site. Correct answer: difficulty swallowing fluids. Difficulty swallowing fluids after cervical spine surgery is a potentially serious complication that requires immediate evaluation. It could indicate nerve damage or swelling in the cervical area that is impacting the patient's ability to swallow, increasing the risk of aspiration and other complications. Immediate intervention is necessary to assess and address any potential threats to the patient's airway and neurological status. Active movement of both arms is an expected finding post-surgery and does not indicate a complication. Minor drainage from the surgical site is typical and does not require urgent attention unless it becomes excessive or shows signs of infection. Postoperative discomfort is common and expected at the surgical site and does not indicate a severe complication. A nurse is preparing educational material on Cushing's disease for a medical seminar. Which of the following statements accurately describes Cushing's disease? A destruction of beta cells in the pancreas. B. Overproduction of thyroid stimulating hormone. C. Reduced secretion of adrenal hormones. D. Increased production of adrenocorticotropin hormone. Correct answer: increased production of adrenocorticotropin hormone. Cushing's disease results from the overproduction of adrenocorticotropin hormone by the pituitary gland, typically due to a benign pituitary tumor called an adenoma. This excessive adrenocorticotropin hormone stimulates the adrenal glands to secrete high levels of cortisol, leading to the characteristic symptoms of Cushing's disease, such as central obesity, muscle weakness, hypertension, and characteristic facial features like a moon face and buffalo hump. The prolonged elevation of cortisol is responsible for the various systemic manifestations of the disease. The destruction of pancreatic beta cells is the hallmark of type 1 diabetes mellitus. Hyperthyroidism, not Cushing's disease, is associated with an overproduction of thyroid-stimulating hormone. A decrease in adrenal hormone secretion is associated with Addison's disease, not Cushing's disease. A nurse is interpreting a client's arterial blood gas results. pH 7.31, PaCO2 52 millimeters of mercury, HCO3 25 milliequivalents per liter. What does this result signify? A. Respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis. Correct answer: respiratory acidosis. The results indicate respiratory acidosis. The pH of 7.31 is lower than the normal range, indicating acidosis. The PaCO2 is elevated at 52 millimeters of mercury, which is above the normal range, indicating that the acidosis is due to a respiratory cause, specifically the retention of carbon dioxide. The bicarbonate level, HCO3, is within the normal range, suggesting that the acidosis is not metabolic in origin. Respiratory acidosis occurs when the lungs fail to expel enough carbon dioxide, resulting in its accumulation and the consequent drop in pH. Respiratory alkalosis is characterized by a high pH and low PaCO2 due to hyperventilation. Metabolic acidosis is characterized by low pH and low bicarbonate, typically due to renal failure or diabetic ketoacidosis. Metabolic alkalosis is indicated by a high pH and high bicarbonate, often due to excessive vomiting or diuretic use. A client receiving prescribed xylostazol is being monitored by the nurse. Which of the following outcomes would indicate that the medication is effective? A. Ability to walk without pain. B. Reduction in cholesterol levels. C. Better visual clarity. D. Enhanced cognitive focus. Correct answer: ability to walk without pain. Cilostazol is prescribed for the treatment of intermittent claudication, a condition commonly associated with peripheral arterial disease. It works by inhibiting platelet aggregation and causing vasodilation, thereby improving blood flow to the extremities. The therapeutic response to cilostazol is demonstrated by the client's ability to walk longer distances without experiencing claudication pain, which indicates improved circulation to the legs. Cilostazol does not directly affect cholesterol levels. Its primary role is in improving blood flow in peripheral arterial disease. Cilostazol is not intended to improve visual clarity. Cilostazol does not influence cognitive functions like focus or attention. A novice nurse is under the supervision of an experienced preceptor while caring for a pediatric patient diagnosed with epiglottitis. Which action performed by the novice nurse necessitates immediate correction? A. Collecting a throat swab. B. Elevating the patient's head using a high Fowler's position. C. Establishing an intravenous line. D. Keeping a resuscitation bag and mask close by. Correct answer: collecting a throat swab. Attempting to obtain a throat swab in a child suspected of having epiglottitis is dangerous and contraindicated due to the risk of inducing a sudden laryngospasm, potentially leading to a complete blockage of the airway. Epiglottitis is a critical condition characterized by severe inflammation and swelling of the epiglottis, which can rapidly compromise the airway. Any invasive procedure involving the throat should be deferred until the airway is secured, typically in a controlled environment such as an operating room, where an artificial airway can be established safely. Placing the patient in a high Fowler's position is beneficial as it helps keep the airway open by leveraging gravity to enhance airflow. Starting an intravenous line is crucial for ensuring that the patient can receive necessary medications and fluids quickly in an emergency. Having a bag valve mask ready at the bedside is a vital precautionary measure, allowing immediate intervention if the patient's breathing deteriorates. A nurse is providing pre-transfusion education to a patient who is about to receive a unit of packed red blood cells. What should the nurse emphasize during the teaching session? A. Your weight will be recorded before we begin the transfusion. B. I will stay with you for the first 15 minutes of the transfusion. C. A urine sample will be needed after the transfusion is complete. D. You'll need to sign a surgical consent form before the transfusion starts. Correct answer: I will stay with you for the first 15 minutes of the transfusion. The initial 15 minutes of a blood transfusion are critical, as this is the period during which transfusion reactions are most likely to occur. The nurse must remain with the patient during this time to observe for signs of adverse reactions, which could include fever, chills, back pain, or more severe symptoms indicative of a hemolytic reaction. Prompt detection and response are essential to prevent serious complications, making continuous monitoring during these first few minutes a key aspect of transfusion safety. Taking a baseline weight is not a routine part of preparing for a blood transfusion, except in specific cases like heart failure, where fluid balance is closely monitored. Collecting a urine sample after the transfusion is not standard practice for monitoring transfusion reactions. A separate surgical consent is not necessary for a blood transfusion. Instead, a specific informed consent for the transfusion itself is required. A patient receiving depot med-roxyprogesterone acetate for contraception makes a statement during a follow-up visit. Which statement indicates the need for further clarification? A. I need to come back for my next shot in 8 weeks. B. This medication might cause me to gain some weight. C. I might experience more bleeding than usual. D. I should focus on doing more weight-bearing exercises. Correct answer: I need to come back for my next shot in 8 weeks. Depomedroxyprogesterone acetate is a long-acting contraceptive method administered every 13 weeks, not every 8 weeks. The patient's misunderstanding of the dosing schedule could lead to missed or mistimed doses, reducing the contraceptive's effectiveness and increasing the risk of unintended pregnancy. It is crucial for the nurse to clarify the correct interval between injections to ensure consistent and effective use of the medication. Weight gain is a common side effect of depomedroxyprogesterone acetate, and this does not require further clarification. Increased vaginal bleeding or spotting is a known side effect of depomedroxyprogesterone acetate, particularly in the early stages of use. Increasing weight-bearing exercises is advised to mitigate the risk of decreased bone density associated with long-term use of depomedroxyprogesterone acetate. A nurse is caring for elderly clients and needs to identify the most common cause of cognitive decline in this population. Which condition is the primary contributor to cognitive impairment in older adults? A cerebrovascular accident. B. Nutritional deficiencies. C. Alzheimer's disease. D. Reduced cardiac output. Correct answer: Alzheimer's disease. Alzheimer's disease is the leading cause of cognitive impairment in the elderly. This neurodegenerative disorder progressively destroys memory, thinking skills, and the ability to perform even the simplest tasks. Alzheimer's disease is marked by the buildup of amyloid plaques and neurofibrillary tangles in the brain, which disrupt communication between neurons and eventually lead to their death. As the disease advances, cognitive functions deteriorate significantly, making Alzheimer's the most prevalent cause of dementia in older adults. Strokes can lead to cognitive impairment, but they are not the most common cause among older adults. Malnutrition can contribute to cognitive decline, particularly through vitamin deficiencies, but it is not the primary cause. While diminished cardiac output can affect overall physical health, it is not a direct cause of cognitive impairment. A client with chronic gout is being treated by a nurse. Which medication is the nurse likely to anticipate being prescribed to reduce uric acid levels? A colchicine. B. Allopurinol. C. Naproxen. D. Prednisone. Correct answer: allopurinol. Allopurinol is the standard medication prescribed to lower uric acid levels in clients with chronic gout. It inhibits xanthine oxidase, an enzyme responsible for the production of uric acid. By reducing uric acid levels, allopurinol helps to prevent the deposition of urate crystals in joints and tissues, thereby decreasing the frequency and severity of gout attacks. It is a long-term management strategy for gout and is essential for preventing complications such as kidney stones and joint damage. Colchicine is used to treat acute gout flares due to its anti-inflammatory properties, but it does not reduce uric acid levels. Naproxen is an NSAID used to alleviate pain and inflammation during acute gout attacks, but does not address uric acid levels. Prednisone, a corticosteroid, may be used to reduce inflammation during an acute gout attack, but does not have an effect on uric acid levels. A nurse is preparing to change the dressing of a patient with extensive burn injuries, including deep, partial thickness and full thickness burns. Which of the following actions would be considered inappropriate before starting the dressing change? A. Administering an oral pain reliever like a COX-2 inhibitor half an hour prior. B. Clearly explaining the procedure to the patient. C. Gently handling the burned areas during the dressing change. D. Providing the patient with a distraction, such as watching TV, during the procedure. Correct answer: administering an oral pain reliever like a COX-2 inhibitor half an hour prior. Administering an oral TOX2 inhibitor, a type of non-opioid pain reliever. Before a dressing change for severe burns is inadequate for managing the intense pain associated with such a procedure. Opioids administered intravenously are the preferred method of pain control in this situation due to their rapid onset and effectiveness in relieving severe pain. Burn wound care is typically associated with significant discomfort, and optimal pain management is crucial to minimize the patient's suffering during the dressing change. Providing a clear explanation of the procedure helps to reduce anxiety and prepares the patient mentally for what to expect. Handling burned areas gently is essential to avoid causing additional pain or damage to the delicate healing tissue. Offering a distraction, such as watching television, can be an effective way to reduce the patient's perception of pain and anxiety during the procedure. A pregnant client at 34 weeks gestation presents with intense itching on her palms and soles, dark-colored urine, and yellowing of the sclera. Laboratory tests reveal elevated bile acids and alanine aminotransferase. What diagnosis is most likely? A. Eclampsia. B. Gestational diabetes. C. Intrahepatic cholestasis of pregnancy. D. Acute fatty liver of pregnancy. Correct. Answer: intrahepatic. Cholestasis of pregnancy. Intrahepatic cholestasis of pregnancy is a liver disorder that occurs during pregnancy and is characterized by pruritus, particularly on the palms and soles, dark urine, pale stools, and jaundice. The condition is diagnosed based on symptoms and elevated levels of serum bile acids and liver enzymes such as alanine aminotransferase. Intrahepatic cholestasis of pregnancy poses significant risks to the fetus, including preterm birth, fetal distress, and stillbirth, making early detection and management essential. Treatment often includes ursodioxycholic acid to improve bile flow and reduce the risk of complications. Eclampsia involves seizures in a patient with preeclampsia and does not present with itching, jaundice, or elevated bile acids. Gestational diabetes is related to high blood sugar levels during pregnancy and does not cause the symptoms described. Acute fatty liver of pregnancy is also a serious liver condition, but it does not typically cause the intense itching seen in cholestasis. During routine hygiene care, the nurse observes that the patient's fingertips are noticeably enlarged with an increased amount of soft tissue under the nails. What condition does this observation most likely indicate? A. Diabetes. B. Iron deficiency anemia. C. Chronic hypoxia. D. Onychomycosis. Correct answer: chronic hypoxia. The patient's description suggests digital clubbing, a sign typically associated with chronic hypoxia. Clubbing is characterized by the enlargement of the fingertips and a curving of the nails around the tips of the fingers. It is commonly seen in individuals with chronic lung diseases, such as chronic obstructive pulmonary disease or congenital heart defects, which lead to prolonged oxygen deprivation. The presence of clubbing often indicates a long-term underlying condition that requires further investigation. Diabetes does not typically cause clubbing, though it can lead to other nail abnormalities. Iron deficiency anemia is associated with spoon-shaped nails, not clubbing. Nail fungus typically causes thickened, discolored nails, not the soft tissue changes associated with clubbing. When conducting an abdominal examination, the nurse should A. Listen for bowel sounds following a visual inspection of the abdomen. B. Begin palpation in the area the patient identifies as painful before examining other areas. C. Use palpation to assess for the presence of air, fluids, or masses. D. Percus to evaluate for tenderness, organ enlargement, or fluid accumulation. Correct answer: listen for bowel sounds following a visual inspection of the abdomen. The correct sequence for an abdominal assessment involves first inspecting the abdomen, then auscultating for bowel sounds, followed by percussion and palpation. This order is important because palpation and percussion can alter bowel sounds, potentially leading to incorrect assessment findings if performed before auscultation. Listening to bowel sounds before any physical manipulation ensures that the nurse obtains an accurate baseline for the patient's gastrointestinal activity. The nurse should palpate the painful area last to avoid causing the patient to tense up, which could interfere with the rest of the examination. Palpation is used to assess the size, shape, consistency, and tenderness of organs and masses, but it does not detect air or fluid. These are better assessed through percussion. While percussion is used to detect the presence of masses, fluid, ascites, or organ enlargement, it is not used to detect tenderness, which is assessed through palpation. A client presents to the emergency department with slurred speech, unsteady gait, and nystagmus. Which condition is the nurse most concerned about? A. Alcohol intoxication. B. Cocaine intoxication. C. Opioid intoxication. D. Alcohol withdrawal. Correct answer, alcohol intoxication. The clinical presentation of slurred speech, unsteady gait, and nystagmus strongly suggests alcohol intoxication. Alcohol intoxication occurs when a person consumes a significant amount of alcohol, leading to central nervous system depression. Symptoms include impaired coordination, slurred speech, and altered mental status. Severe alcohol intoxication can lead to respiratory depression, coma, and death, making it a medical emergency. Cocaine intoxication usually results in dilated pupils, increased heart rate, and hyperactivity, which contrasts with the symptoms of alcohol intoxication. Opioid intoxication typically presents with pinpoint pupils, respiratory depression, and slow breathing, which are not consistent with the symptoms of alcohol intoxication. Alcohol withdrawal presents with symptoms such as tremors, agitation, anxiety, and in severe cases, seizures, rather than the slurred speech and unsteady gait seen in alcohol intoxication. A patient diagnosed with Alzheimer's disease has just finished their meal in the communal dining area. Shortly after, they ask the nurse, "When will I be served breakfast? I haven't eaten anything yet today." Which response from the nurse would best address the patient's concern? A. You had breakfast just a little while ago. B. Do you feel hungry? Let me check what you had. C. Would you like something to eat? I can bring you some bread. D. Breakfast time is over. You'll have to wait until lunch. Correct answer. Would you like something to eat? I can bring you some bread. Patients with Alzheimer's often struggle with short-term memory, leading them to forget recent activities, like eating a meal. The nurse's role is to minimize the patient's distress by offering comfort without arguing or creating confusion. Offering food is an effective strategy as it acknowledges the patient's immediate need and provides reassurance. By offering food, the nurse meets the patient where they are emotionally, which is a key aspect of person-centered care that emphasizes responding to the patient's current reality rather than trying to correct their memory. Saying that the patient had breakfast a little while ago might lead to frustration or anxiety in the patient, who may not remember eating. Correcting them directly can heighten confusion. Checking what the patient had adds to the patient's confusion and doesn't directly address their current emotional state. Saying breakfast time is over and the patient has to wait until lunch dismisses the patient's expressed need and fails to provide the necessary comfort or support, which is crucial for patients with cognitive impairments. A healthcare provider orders 500 milligrams of metronidazole to be administered intravenously over a 30-minute period. The pharmacy provides the medication in a 100 milliliter saline solution, labeled with 500 milligrams of metronidazole. At what rate should the nurse set the intravenous infusion pump to deliver this medication? Correct answer: 200 milliliters per hour. To ensure accurate administration, the nurse must calculate the infusion rate in milliliters per hour. First, convert the time from minutes to hours. 30 minutes equals zero point 0.5 hours. Then, apply the formula for determining the infusion rate. Rate in milliliters per hour equals volume in milliliters divided by time in hours. Substituting the values, rate equals 100 milliliters divided by zero point 0.5 hours, which equals 200 milliliters per hour. This result indicates the intravenous pump should be set to deliver the medication at a rate of 200 milliliters per hour, ensuring the correct dosage is administered within the prescribed time frame. Additional information. Metronidazole is a potent antibiotic targeting anaerobic bacteria and certain parasites. It is commonly used to treat infections such as those caused by Clostridium difficile. Nurses should monitor for signs of intravenous site complications, educate patients on possible side effects like a metallic taste or darkened urine, and advise them to avoid alcohol during treatment due to the risk of a disulfiram-like reaction. A patient presents with difficulty breathing, crackling sounds in both lungs, weak pulses, and pink, frothy sputum. Which of the following prescribed interventions should the nurse reconsider? A. Administering oxygen via nasal cannula or mask. B. Giving losartan as prescribed. C. Positioning the patient in Fowler's position. D. Administering diltiazem. Correct answer, administering diltiazem. The patient's symptoms are consistent with acute left-sided heart failure, characterized by pulmonary edema, evident from the frothy sputum and lung crackles. Diltiazem, a calcium channel blocker, may worsen heart failure by decreasing myocardial contractility, thereby reducing the heart's pumping efficiency. Given these risks, the nurse should question this order and consider seeking an alternative treatment that does not exacerbate heart failure symptoms. Administering supplemental oxygen is critical for patients in respiratory distress, improving oxygenation. Losartan, an angiotensin II receptor blocker, helps reduce afterload and improve cardiac output, making it beneficial in heart failure management. Fowler's position promotes better lung expansion and oxygenation, easing the work of breathing in heart failure patients. In the emergency room, a patient is triaged after experiencing a sudden onset of anxiety, nausea, chest tightness, and a sense of impending doom. Which initial action should the nurse prioritize? A. Screen the patient for suicidal ideation. B. Perform a 12-lead electrocardiogram. C. Build a therapeutic relationship with the patient. D. Identify what triggered the panic attack. Correct answer. B. The patient's symptoms, while possibly due to a panic attack, can also mimic those of a myocardial infarction, heart attack. It is essential to first rule out any life-threatening conditions, such as acute coronary syndrome, by obtaining a 12-lead electrocardiogram. If the electrocardiogram shows no abnormalities, the nurse can then focus on addressing the panic attack. Prioritizing the electrocardiogram ensures that the patient's immediate physical health is thoroughly assessed before considering psychological factors. Choice A is important, but secondary to ruling out a potentially life-threatening cardiac event. Choice C is valuable in managing anxiety, but is not the immediate priority when a physical condition could be at play. Choice D might help in managing the panic attack, but should only be done after excluding the possibility of a more severe underlying condition. The nurse is educating a client about advanced directives as part of their care plan discussion. This information primarily supports which of the following client rights: A. Privacy. B. Access to emergency care regardless of payment ability. C. Autonomy. D. Pain management. Correct answer: C. Advanced directives allow clients to convey their preferences regarding medical care in situations where they might be unable to communicate their wishes. By providing information on advanced directives, the nurse supports the client's right to autonomy, enabling them to make informed decisions about their future health care. This right to self-determination is foundational in ensuring that the client's wishes are respected and followed, which is a core aspect of patient-centered care. Choice A is incorrect because privacy relates to the protection of personal health information, not directly to advanced directives. Choice B is unrelated as it concerns legal rights to emergency care, not self-determination through advanced directives. Choice D pertains to the standard of care for pain management, but is not specifically linked to the concept of advanced directives. During an assessment, a client is suspected of having acute cholecystitis. Which clinical finding would most strongly indicate this diagnosis? A. Lowered bilirubin levels. B. Elevated high-density lipoprotein cholesterol. C. Decreased liver enzymes. D. Elevated white blood cell count. Correct. Answer: D. Acute cholecystitis, an inflammation of the gallbladder typically caused by gallstones, triggers an immune response that often leads to an elevated white blood cell count. This increase in white blood cells is part of the body's reaction to inflammation and infection. Accompanying symptoms like fever, upper right abdominal pain, and jaundice further support this diagnosis. The presence of elevated white blood cells, coupled with clinical symptoms, strongly suggests acute cholecystitis. Choice A is incorrect, as bilirubin levels are usually elevated in cholecystitis due to bile obstruction, not decreased. Choice B is not relevant because high-density lipoprotein cholesterol is more related to cardiovascular health than to gallbladder inflammation. Choice C is incorrect because liver enzymes typically rise in response to inflammation or bile obstruction in cholecystitis. The nurse reviews a client's lab results and observes that the potassium level is 5.6 milliequivalents per liter. Normal range, 3.5 to 5.0 milliequivalents per liter. What electrocardiogram change would the nurse most likely anticipate? A. Tall P-kid T waves. B. ST segment elevation. C. Prominent P waves. D. Pronounced U waves. Correct answer: A. Hyperkalemia, characterized by an elevated potassium level, significantly impacts the heart's electrical activity, most notably causing tall, peaked T waves on an electrocardiogram. These T waves are a result of the altered repolarization process due to the increased potassium levels. As hyperkalemia progresses, it can lead to other severe electrocardiogram changes, including a widened QRS complex, which may precede life-threatening arrhythmias if not promptly addressed. Choice B is incorrect, as ST segment elevation is typically associated with myocardial infarction, not hyperkalemia. Choice C is incorrect because prominent P waves are more indicative of atrial abnormalities rather than hyperkalemia. Choice D is incorrect because pronounced U waves are more commonly seen in hypokalemia, the opposite condition of hyperkalemia. A nurse is tasked with administering an intravenous infusion of heparin at a rate of 15 units per kilogram per hour for a client who weighs 70 kilograms. The available heparin concentration is 25,000 units in 250 milliliters of dextrose, 5% in water. How many milliliters per hour should the nurse set the intravenous pump to administer? Round to the nearest whole number. Correct answer: 11 milliliters per hour. To accurately administer the prescribed heparin dosage, the nurse must calculate the correct infusion rate based on the client's weight. First, determine the total heparin dose required per hour. 15 units per kilogram per hour times 70 kilograms equals 1,050 units per hour. Next, using the concentration provided, rate, milliliters per hour, equals dose, units per hour, divided by concentration, units per milliliter, times volume, milliliters. Here, the concentration is 25,000 units per 250 milliliters, which simplifies to 100 units per milliliter. Rate equals 1,050 units per hour divided by 100 units per milliliter equals 10.5 milliliters per hour. Rounding to the nearest whole number results in 11 milliliters per hour. Additional information. When administering intravenous heparin, it is crucial to monitor the patient's activated partial thromboplastin time regularly to ensure the dose remains within the therapeutic range. Nurses must also be vigilant for signs of bleeding, a common adverse effect of heparin therapy. A client scheduled for a hip replacement expresses significant anxiety about the upcoming surgery. What is the most therapeutic response by the nurse? A. It's normal to feel anxious before surgery. Everyone does. B. Let me explain the procedure step by step for you. C. Can you share what you've been told about the surgery? D. I'll walk you through what to expect during recovery and the potential pain. Correct answer, C. The most therapeutic response involves inviting the client to express their understanding and concerns about the surgery. By asking the client to share what they know, the nurse can identify any misinformation or gaps in knowledge and address specific fears. This approach fosters open communication and provides a platform for the client to voice their anxieties, which can then be managed effectively. Choice A is less effective as it generalizes the client's feelings, which may be perceived as dismissive. Choice B assumes the client is seeking information rather than expressing anxiety, potentially missing the underlying emotional concern. Choice D offers valuable information, but does not first address the client's expressed feelings, which is critical in managing preoperative anxiety. A family member of a patient lodges a complaint with the nurse manager about the care provided during the night shift. What should be the nurse manager's first course of action? A. Instruct the night charge nurse to ensure all duties are performed appropriately. B. Discuss the complaint with the night shift nurse and review the care provided. C. Investigate the complaint by talking directly to the family member and the patient. D. Document the complaint in the relevant employee's file without further action. Correct answer, C. The nurse manager's initial response should be to gather detailed information about the complaint by speaking directly with the family member and the patient. This allows for a thorough understanding of the issue from the complainant's perspective. Only after a comprehensive assessment should further steps, such as discussing the matter with the staff involved or documenting the findings, be taken. This approach ensures that any action is fair, evidence-based, and addresses the concerns effectively. Choice A bypasses the critical step of investigating the complaint and may lead to inappropriate conclusions. Choice B is premature, as it involves discussing the issue with the night nurse before understanding the complaint fully. Choice D is inappropriate, as documenting a complaint without investigating could be unfair to the employee and does not resolve the underlying issue.